Hello everyone. This video will help you to learn more about nutrition assessment in children. I am Dr. Celeste Mary, Vice Principal in Administration at Triplum College of Nursing. Introduction about the topic is the nutritional status of an individual is often the result of many interrelated factors. It is influenced by food intake, quantity, quality and physical health. The spectrum of nutritional status spread from obesity to severe malnutrition. Moving on to the definition, nutritional status is the current body status of a person related to their state of nourishment. It means the consumption and the utilization of nutrients. Purpose of nutritional assessment is to identify the individuals who are at risk of becoming malnourished and also to identify the individuals who are malnourished, to develop the healthcare programs that meet the community needs which are defined by the assessment, and to measure the effectiveness of nutritional programs and interventions once initiated. Next is methods of nutritional assessment. There are two methods of assessment, indirect method and direct method. The direct method deals with the individual and measure objective criteria, whereas indirect method uses community health indices that reflects nutritional influences. First method is indirect method of nutritional assessment. There are three categorization: ecological variables including the crop production, economic factors, example the per capita income, population density and social habits. Vital health statistics, it includes the infant, under 5 mortality and fertility index. All this categorization will help us to identify the nutritional status of an individual. Second one is direct method of nutrition assessment. Here direct method deals with an individual which measure the objective criteria that summarize as A, B, C, D. A stands for the anthropometric measurement, B for biochemical and laboratory methods, C is for clinical methods or the clinical science, and D dietary evaluation or dietary assessment. Coming to anthropometric measurement, it is a measurement of height, weight and proportion. It is also an essential component of clinical examinations of infant, children and pregnant women. Also, it evaluates both under and over nutrition of a children. The measured values reflect the current nutrition status and don't differentiate between acute and chronic changes. Next, under direct method of nutritional assessment, biochemical and laboratory method. Hemoglobin estimation is an important investigation to rule out the state of nutrition of an individual and to find out the anemia. Stool examination is to identify the presence of ova and intestinal parasites. Urine dip test and microscopic test to identify the albumin, sugar and the blood of an individual. Measurement of individual nutrients in the body fluids like serum retinol, serum iron, urine, iodine, vitamin D, etc. And the detection of abnormal amount of metabolics in the urine, analysis of hair, nails and skin for micronutrients. These are the methods to identify the nutritional assessment of the individual. Moving on to clinical method of nutritional assessment. It is an essential feature of all nutritional surveys and also it is the most practical method of ascertaining the nutritional status of a group of an individual. A number of physical signs that are known to be associated with malnutrition and deficiency of vitamins and micronutrients. Good nutritional history should be obtained from an individual. General clinical examinations and head-to-foot assessment lend a special attention to the organs like hair, angles of mouth, gums, nails, skin, eyes and the tongue, muscles, bones and the thyroid glands. It is a key factor to identify the nutritional condition of an individual. Detection of relevant signs helps in establishing the nutritional diagnosis. Next we can move on to some of the clinical signs of nutrition deficiency. That is in hair. If it is spare and thin, it indicates the protein, zinc, biotin deficiency. If it is easy to pull out, protein deficiency, and coiled hair indicates the vitamin C and vitamin A deficiency. And in mouth, if it is the inflammation of the tongue, it represents the deficiency of riboflavin, niacin, folic acid and vitamin B12. Bleeding and spongy gums indicates vitamin C, A, K, folic acid, niacin deficiency. And it is angiostomatitis, scoliosis and fissure tongue represents the B2, B6 and niacin deficiency. If it is leukoplakia, it indicates vitamin A, B12, B complex, folic acid and niacin deficiency. And the sore mouth and tongue represents vitamin B12, vitamin C, niacin, folic acid and iron deficiency. Moving on to skin, pale skin indicates the folic acid and iron and B12 deficiency. Follicular hyperketosis indicates the vitamin B and vitamin C deficiency. Dermatitis indicates protein energy malnutrition, vitamin B2 deficiency, vitamin A, vitamin zinc and niacin deficiency. Pigmentation and desquamation indicates the niacin and protein energy malnutrition. Bruising and purpura on the skin indicates vitamin K, vitamin C and folic acid deficiencies. And in eyes, night blindness, xerophthalmia indicates the vitamin A deficiency. Photophobia, blurring of vision, conjunctival inflammation, all this indicates the vitamin B2 and vitamin A deficiencies. Moving on to the nails, spooning shape of nails indicates the iron deficiency. Transverse line represents the protein deficiency. Coming to joints and bones, it helps to detect the signs of vitamin D deficiency, that is rickets, and vitamin C deficiency, scurvy. Finally, we have to do the dietary assessment, that is the dietary evaluation in different 5 methods, that is 24 hours dietary recall, food frequency questionnaire, and dietary history, how often they are taking the food, and food dietary technique, absorbed food consumption details. Coming on to conclusion, nutrition assessment is to identify individuals who are at risk of becoming malnourished and also to identify the individual who are malnourished. The key method of nutrition assessment is direct and indirect method. Thank you.